if you are unvaccinated, you need to be wearing a mask to protect yourself and others around you. And we need more people to get vaccinated to stop this pandemic. So overall, the CDC recommendations haven't changed.
There has been no decision to change our mask guidelines. If any decisions about public health would be driven by the CDC. But of course, we are engaged with public health experts and the CDC about how to continue to attack the virus.
Well, there is a resurgence, that's clear, and now there are debates in different states about mask mandates coming back, not coming back, what happens with the vaccine. The president this afternoon repeating what he said at the town hall last night about the vaccine and going forward. Take a listen.
We have a pandemic among the non-vaccinated, those who are not vaccinated. If you are vaccinated, you are safe. If you are vaccinated, you have over a 98% chance of never catching the virus at all. If you catch it, you're likely to, the overwhelming proof so far is you're not going to be hospitalized, you're not going to be sick, you're going to probably have no signs that you had it.
Well, the CDC has new numbers out about that, and these numbers are actually from July 12th, so they're a little old, but they're breakthrough COVID-19 cases. 5,189 Americans have been hospitalized from breakthrough cases. This means you've had vaccinations and you still got COVID, and they went to the hospital. 1,063 Americans have died from breakthrough COVID-19 case. 75% of all those who were hospitalized or died from a breakthrough case were age 65 years or older. And this is the Delta variant that everybody's talking about. So with that, let's bring in our panel. Ben Domenech, publisher of the Federalist. Juan Williams is a Fox News analyst, and Steve Hayes, editor of the Dispatch. Steve, there is this debate, and you know, the president seems to be indicating that the CDC is going to change its guidelines soon.
Yeah, he's indicated that, and he's also suggested that the CDC may allow children under 12 to be vaccinated, which I think would be a welcome development at this point. Look, I think it's unfortunate that we're having a debate about going back to masks for a number of reasons. Primarily because if you have a debate about going back to masks, it suggests to people who are vaccine hesitant that there's not the kind of upside that we've been promising all along to getting vaccinated. And I think that's the kind of mixed messaging that we don't want from the White House. Having said that, the only reason we're having this debate about potentially having to go back to masks is because you have irresponsible people who are pretending that there's no difference between being vaccinated and between being unvaccinated. Many of those are charlatans and hucksters on the right who are, you know, in just asking questions mode, pretending that there's really not much to know about being unvaccinated versus being vaccinated, or that there's not real scientific evidence that being vaccinated provides an advantage, a significant advantage to surviving, to avoiding getting infected in the first place and to surviving any COVID infection that you have.
About the masks and the vaccines, Peter Doocy had a little back and forth with Jen Psaki on this issue.
I think a lot of people got the vaccine because they were hearing him say, if you get the vaccine, you don't have to wear masks anymore. So,
and that continues to be CDC guidance.
And you can say that that's going to be the guidance forever.
I am not the CDC director.
I understand, but people don't care who tells them to wear a mask.
They should care.
If it's the White House,
shouldn't they care if it's a doctor, a medical expert, or a spokesperson? I think most Americans actually do care.
It's the government.
Okay.
Ben?
Well, I think that first off, there's no basis to have any kind of masking for young children who are going back to school, which is obviously a major point of contention that we see playing out across the country and has a major role related to these mask mandates. You could potentially see an argument made that it would make teachers more comfortable or something like that. But circling back to Steve's point, I'd like to see the evidence that the driving element for people not getting vaccinated is, as he says, hucksters on the right. I don't really see that. In fact, I see almost total unanimity on the right in terms of people recommending that people ought to be vaccinated, certainly among the political class. And if there are hucksters who are out there who are saying these types of things, I certainly don't think that they have the kind of truck, the kind of pull in this country in order to have this type of effect. I think the far more reasonable and obviously I think data-supported approach is to say that in every aspect of the promises related to vaccinations, vaccination, we have seen the government pull the rug out from underneath people over and over again about whether they were going to be able to go back to living a normal life. And that instead of having the ability to go back to that, they're being told once again of the potential of mandates, lockdowns, demands on their children, prevention of being able to go back to living the way that they thought they were going to be able to if you had a significant portion of Americans vaccinated. That's a far bigger danger when it comes to discouraging vaccination than anything that I've heard from any huckster.
All right, quickly, Steve,
can I clarify? Yeah, can I clarify? So I didn't say that was the cause. I said it was a problem. It is a problem. And if Ben doesn't know where the problem exists, I suggest he pay more attention. Clearly, there are people, particularly on the right,
That's
not
laughable,
exclusively
Steve.
on the right, particularly on the right, who are actually making that case.
I'm sorry.
Yeah, if you don't think that it's a problem that people are pretending that there's no problem, if you don't think it's a problem that there are people on the right who are pretending in the manner of just asking questions that there's no difference between being vaccinated and unvaccinated, I do think you ought to pay closer attention.
I said it was a problem. I said it was a problem when Kamala Harris said that there was questions about vaccines under Donald Trump, and it's a problem, obviously, of anybody questioning it. I don't see anybody of the stature of Kamala Harris on the right today saying that people ought not be vaccinated.
All right, Juan's on this panel too. I can't wait till you guys get back in studio so that the whole box thing and the Brady Bunch thing goes by the wayside. I want to play this soundbite about kids masked in schools. Ben mentioned it. Take a listen.
The CDC is going to say that what we should do is everyone under the age of 12 should probably be wearing a mask in school. That's probably what's going to happen.
I think it's a scary thought that the President of the United States is making a forecast about what the CDC is probably going to do. For the federal government to make some kind of big decision for the whole nation is wrong. The local school boards make those decisions.
What about that, Juan?
Well, it's unlikely that children under 12 are going to be vaccinated before school gets started, so they're looking for precautions to protect children. I was with the governor of Maryland today, Republican Larry Hogan. You said he doesn't know if they'll start doing that before, next year, vaccinating those kids. So the reality is that the best way to protect the kids right now is for everyone to get vaccinated. If everyone's vaccinated, then the kids are going to have almost no exposure to the virus. I mean, we have a solution that doesn't involve anybody imposing anything on anyone, just saying, you know what, let's act in the best interest of our health, our families, and our children in terms of getting the vaccination. There's no way for kids to get it if everyone's vaccinated.
Ben, last word here.
I just don't think that we can set this kind of rules at the federal level. I think to the point that of the parent that you were quoting there, these decisions ought to be made as close as possible to the localities, to the people, and to the people who are facing these challenges, which are widely different across America when it comes to the level of challenge. And I think that we do need to keep in mind parents ought to be able to direct how their children live and how they are treated. That is not the role that the government ought to supersede in any respect.
All right, Steve, you want to agree with Ben to wrap up the panel? Or?
No, I think that's right. I mean, as a general case, the principle of subsidiarity suggests that people closest to this decision should be making the decision. I think when you have overwhelming evidence of the success of the vaccines, it's fine to ask legitimate questions about the long-term implications, but it's best to follow the science.
Hey, Sean Hannity here. Hey, click here to subscribe to Fox News YouTube page and catch our hottest interviews and most compelling analysis. You will not get it anywhere else.